Bismillahirrahmanirrahim. Hello again. This is Dr. Adel Shabana, Assistant Professor of Cardiology in October 6 University, and we will continue neck vein examination for skill lab for fourth year. This is the third lecture about the jugular venous pulsations or waves. Okay, I know that this part will remind you of the physiology, but it's very important to understand what should be in the neck veins. So let's take the right atrium. What's happening in the right atrium pressure during the cardiac cycle? Before we start, we have to know that the pressure in the right atrium, which is reflected in the neck veins, it will increase either with contraction of the right atrium or because of venous return. So more blood will cause more pressure, or contraction will cause more pressure. On the opposite side, if blood is evacuated from the right atrium, pressure will drop, and if the right atrium is relaxing, pressure also will drop. So let's take, as we always do in the cardiac cycle, usually we start with atrial contraction. So atrial contraction is the last stage during ventricular diastole. At this time, the remaining blood in the right atrium will contract to evacuate the remaining blood into the right ventricle. So at this stage, tricuspid valve is open and the right atrium is evacuating its blood in the right ventricle. So because there is contraction, the wave is positive wave, because the pressure in the right atrium will increase. There is contraction. Pressure in the right atrium will increase, and this will be reflected by a positive wave in the neck veins. We call it A wave. A for atrial contraction during this phase, and this is of course the last phase in diastole. If we are saying this is the last phase of diastole. Okay, what will happen in the cardiac cycle after that? After this stage, the ventricle will start to elevate its pressure because it wants to open the pulmonary valve, and the pressure in the ventricle is very low. So the ventricle will start to do contraction. It will close the tricuspid valve here. Tricuspid valve will be closed, and after the isovolumetric phase, the pulmonary valve will be open to for the ventricle to evacuate. So here is a ventricular systole. Okay, what will happen in the right atrium? In the right atrial pressure, first the pressure will drop because the atrium is now relaxing. Here the atrium was contracting. Here the atrium is now relaxing. So pressure will drop. Instead of after the A wave, it will become what we call X descent. Okay, and then during ventricular systole, the atrium is having venous return. Okay, so blood is coming back from the body into the atrium, filling the atrium, elevating the pressure inside the atrium, so pressure starts to be high again, producing what we call V wave. And V, you can say that V is for venous return, or V is for ventricular systole, because it occurs during systole. Okay, after the systole finishes, ventricle now evacuated the blood it wants. What will happen? The ventricle will do the opposite. The pressure will drop. Isovolumetric relaxation phase, pressure will drop quickly in order to close the pulmonary valve and open the tricuspid valve. So when the tricuspid valve is opened, blood will gush from the right atrium into the right ventricle, and because blood is gushing out, the pressure will drop again in the right atrium or in the neck veins, producing another descent which is called Y descent. And then at the end of diastole, the right atrium will contract and produce the A wave again. So we have two, in general we have two waves. Forget about the C wave, but we have two waves. A wave and V wave are positive waves, and X wave and Y wave are negative wave. Positive and negative means the skin itself, we will find the skin getting out. The vibration we are seeing is either to outward or to inward. يعني it looks like it is bulging or sucking inside. So A wave is a diastolic wave due to occurring during ventricular diastole. It is due to atrial contraction. Then X descent is a systolic negative wave X descent from relaxation of the right atrium, and then V wave, which is a positive wave again due to feeling of venous return, and it is again during systole, and then the Y wave, which is during diastole, which is a descent due to evacuation of blood from the atrium. So A and V are positive waves, X and Y are negative waves. So we are, practically speaking, we are expecting to see 4 waves. I mean, like we see the waves with each heartbeat, we should find one positive wave followed by a negative, then one positive wave followed by a negative. Actually, this is very difficult, of course, to appreciate in normal person. So usually we can see one wave, or maximally we can see 2 waves, either the 2 positive waves, or sometimes some people can see the 2 negative waves. And if we want to put the heart sounds here, after the A wave, the mitral valve, the mitral and tricuspid close. So this is the place where there is S1, and here, when the venous return is getting in the atrium and ventricle finishes evacuating its blood, here the aorta and the pulmonary valves will close, producing S2. So in general, if we want to comment on a positive wave, if a positive wave comes before S1, it is A wave. And of course, S1 is the same like carotid impulse. So this is why we will compare the waves using the carotid impulse, because when you feel the carotid pulse, or you hear the apex and hear the first heart sound, the wave which is nearly synchronized with it is an A wave. Okay, and if you find a descent synchronized with it, it is the X descent. But away from the carotid pulse or coming near to the S2, you will find the V wave and the Y descent. So again, let's return back to what we are saying. As we said, we'll find a peak, a positive peak, which is A wave, then a trough or a negative, which is X descent. Then you will find another, a positive one, which is V wave. Then you will find a Y descent. All this with each heartbeat. So what we will do now, after we calculated the pressure as in the previous lecture, now we will look at the waves and see what's going on. If I am seeing a positive wave or a negative wave, I want to see if it is very near to the carotid pulse or not. So I will use my hand, my right hand here, to palpate the left carotid, and please don't do it with the radial. You have to do it with the carotids. Okay, and we cannot do with the right carotid because it will mask the waves we are seeing. So we have to use the left carotid. So you put your fingers and try to find the left carotid of the patient, and then you concentrate on, when you are feeling the carotid by your finger, what is there is any waves coming in the same time or not? So if there is a positive wave coming in the same time with the carotid, this is A wave. If there is a positive wave but it is coming after you feel the carotid, this is a V wave. If both are there, then there is A and V. And the same applies to X and Y waves. Okay. Let's take some abnormalities and see. Actually, this is skill lab, so usually we don't talk about abnormalities, but just to know. For example, as we said, the A wave is due to atrial contraction at the end of diastole in order to evacuate its blood. And of course, logically, the tricuspid valve should be open. So if someone has tricuspid stenosis, okay, the right atrium will try to contract and evacuate blood against this stenosis. So the pressure will be very high and you will find a very high A wave. The same if there is pulmonary hypertension or pulmonary stenosis, because the pressure will be transmitted back and the atrium has to contract against a high pressure. So the A wave will be prominent. And opposite to that, the patients who have atrial fibrillation, there is loss of atrial contraction, loss of the contraction itself. So you will not find A wave. Okay, what about V wave? V wave, if it is a V wave, will be higher if there is tricuspid regurg. Why? Because Tricuspid regurg occurs during systole. So normally, during the ventricular systole, the tricuspid valve should be closed. So the pressures are not transmitted up to the atrium. And the atrium is relaxing and then starting to fill with blood, as we said. But in cases of tricuspid regurg, the tricuspid valve is not closing well, so with ventricular contraction, blood will go back into the atrium, elevating the pressure. So it will become a prominent V wave, and even sometimes the X descent is completely lost. There is also another thing related, which is called cannon wave. What is cannon wave? Cannon wave are very large A waves, but they are not diastolic A waves. In this case, let us imagine that atrium and ventricle both in the same time contracts. For example, in some cases of heart block, the electrical stimulation of the atria is separate from the ventricle. Each one of them has a separate pacemaker. So atrium and ventricle both will contract in the same time. Of course, the ventricular pressure will be higher, so blood will not go from the atrium to the ventricle, but even blood can go from the ventricle to when the atrium contracts, it will find ventricular systole, so blood cannot be evacuated from the atrium to the ventricle. So the pressure in the atrium will be very high, producing what we call cannon waves, which are indication of one of the examples of in case of heart block. So in summary, you position of the patient, okay, if usually 30 to 45, sometimes you need to put down more or up more. Then patient will turn his neck to the left side halfway. You look tangentially with a torch and try to see the pulsations. Confirm that it is venous. After you look for some time, you can press on it and see if you can feel or not, and press at the root of the neck. Then you find the sternal angle, put a ruler vertically on the sternal angle, and put another one horizontally from the highest point of the pulsation in the internal jugular, and try to see how many centimeters it is vertically above the sternal angle. This vertical distance is the distance we measured up to the sternal angle. Then you add 5 to this number in order to comment correctly on the GVP by centimeter water from the right atrium. Then you look on the waves, look at the waves again, determine what you are seeing. You are seeing positive wave, negative wave, 1 or 2, and then you put your hand on the left carotid and try to find it and see if the wave is coming with the left carotid. This is an A wave. If the positive wave is away from the carotid, this is a V wave. The two remaining things, if you are allowed, then you have to check the hepatojugular reflux, putting your hand on the abdomen for several seconds and see if the neck vein will become congested and remain congested. And the last one, the effect of respiration. So if the patient take deep breath and the neck veins become more congested and more pulsation gets higher, this is called the Kussmaul sign. Normally the opposite is happening, then the discussion will occur about the different abnormalities in neck veins. Thank you.